Hi guys, Dr. Sandhu here from iMedics. A short video for you today on how to take a pain history. So, we at iMedics do a lot of revision courses, whether they're on Skype or indeed face-to-face, we're one-to-one in small groups. And what we find, is we've got students from different stages of their careers. Some of you guys will be doing the PLAB exam, the PLAB 2. Some of you will be doing the GP entrance exam, some will be doing the CSA exam, and some will be doing med school finals. So we get a good range of different students and doctors coming to us for courses. And so there's a bit of a trend that we often notice, and that is that some of you lack a structure when it comes to doing a pain history. A pain history is very important, and they're very common. It's tested in lots of exams, and something you'll be doing day to day when you qualify, whether that's as a GP or as a doctor in the hospital. You'll be seeing lots of cases of pain, whether it's in the chest, abdomen, arm, and so forth. So in terms of what structure to have, well, the one that I commonly use is the Squids mnemonic, and I'll go through that in a bit more detail. But you may have your own system. Some people use Socrates, and you may have something completely different that you were taught or you've learnt. And go with one that feels comfortable, but make sure that you get the relevant information, because a good history will pick out the key information and allow you to generate an appropriate differential and manage the patient appropriately, and of course get your top marks in your exams as well. So Squids is something I used from the beginning, from medical school, through my exams as a junior doctor, through my CSA exam, and it's worked very well for me. So it's the one that I like to teach and share with my students. So the key thing to remember is that when you kind of start your history, of course you'll have asked your open question. The patient will say, look, I've got some chest pain, and you may say, okay, can you tell me more about this chest pain? So you've got your mark now because you've asked the open question. When you practice with your friends, many of them will give you lots of information, and so that gives you a false sense of security. When you do your exams, however, you have professional actors, and those guys will not give you the information that you want unless you ask for it, and that's because they're there to test how you do the history and whether you can do it in a structured way to get the relevant information. So as an example, if I was to ask a patient, tell me a bit about what brings you in today, that's a general question. They may say, doctor, I've got this pain in my chest. I may then say, okay, can you tell me more about this pain in your chest? That's an open question, inviting lots of information. The actor will say, well, what do you want to know? Now, once they say that, I now know, okay, I now need to become a bit more focused. I need to try and work out what's going on. So that's when my Squids comes in. So the S stands for sight. So can you show me where you're getting the pain? And the patient may be able to show you directly. You can ask them to point to the body parts and so forth. Does the pain go anywhere else? So if we're talking about chest pain that started centrally and now it's going to the jaw and the left side of the arm, we're starting to think about a heart attack straight away. The Q stands for quality. Can you describe the pain to me? Now, some patients will use different terms. Some will say it's a dull ache, some will say it's a sharp pain, a stabbing pain, a burning feeling. The quality bit of the Squids is important, because if they describe a burning feeling, you start to think of a gastro cause, so something like a gastroesophageal reflux. So you can now see that the questions are guiding your mindset into what you think might be going on with this patient. The I stands for intensity, so that's what normally we use a visual analog scale, which is a pain scale, scoring a pain from 0 to 10. So I normally explain it very quickly. So, Mr. Smith, how would you score the pain if 0 was nothing and 10 was like having your teeth pulled out by a dentist? What would you score the pain as? And they'll give you an idea. That will give you an idea as to how severe the pain is. If it's 10, we know they're really struggling with it. If it's a 3 out of 10. It might mean that it's not affecting them as much, but it's a good question to ask. T for timing. So when did the pain start? So if the pain started 12 hours ago, how has the pain changed since then? If the pain started 4 weeks ago, you may be dealing more with a chronic case, but the timing is very important. Then you've got A for aggravating factors. So what makes the pain worse? R for relieving factors. Have you noticed anything that eases the pain off? Now, when you look at the aggravating and the relieving factors, what you'll find is that can also give you an idea as to what might be the cause. So if we stick with the example of the chest pain, if the patient says to you, well, look, it hurts when I press and twist and move, that's an aggravating factor, or they're the aggravating factors, then we know it's more likely going to be musculoskeletal pain, because it's not going to be a heart attack if them pressing on the chest, you know, on a specific point is triggering the pain. And similarly, you know, it gives you an idea if certain things aren't working, if painkillers, if anti-inflammatories aren't working, or they're making the pain worse, are we dealing with reflux? Is it a heart problem? But it gives you much more of an idea. Then you've got the notion of P, and this is the P in the Squids, which is basically previous episodes or previous symptoms. Has this happened to you before? And if it has, what happened last time? And that again will give you an idea as to where you're going to take the next stage of your history and your subsequent examination and management. Then you move on to the S, and the S is the secondary symptoms. And this is where you really kind of focus in, and now you start to work out, okay, what exactly is going on with this patient? So normally I say something along the lines of, Mr. Smith, I've got some more specific questions to ask you so that I can work out what is going on. Would that be okay? Of course, the patient will say yes. So if we stick with chest pain, we've touched on the fact that there could be cardiac causes, and you may have already worked that out if the patient has told you that, you know, starts here, radiates to the left shoulder. But could it be a respiratory cause? Things like a pneumonia. So have you noticed a chesty cough at all? Have you coughed up any blood? Have you had any fevers? Could it be tuberculosis if we're dealing with a chronic case or a more of an acute case? You know, have you had any night sweats, any fevers, any weight loss? You know, these are reasonably good questions to ask, especially if it's a, you know, in this kind of history. Pulmonary embolism. Have you noticed any pain in your calf? Any swelling in your legs? Of course, you can get hemoptysis as well. So we've already covered that in the question that we asked about coughing up the blood. So you can quickly see that you've gone through cardiology and you've gone through respiratory. The third thing you want to be thinking about is gastroenterology. So you can ask, you know, have you noticed any burning feeling at the front of your chest, just in case it is an acid reflux? And you can see very quickly that now you've started to narrow down and you're starting to work out what could be going on with this patient. So that's a very short overview of a pain history. I hope you did find that useful. Squids is the mnemonic that I use. Like I said, you may have your own one, but try it, see how it feels, practice it with your friends. We'll put some links down below for our revision courses. And of course, you know, our free learning that we have as well on YouTube, Instagram and Twitter, as well as our Facebook pages. And if you do have any questions, get in touch and we'll see you guys soon.